Here are the first 3 things that I will check if someone comes to see me who's got hair loss. The first I'm going to check is for the androgens. I either do this through a pathology test or through a dried urine test, and what I'm looking for are the androgens. As we go into perimenopause and through into menopause, what will happen is our estrogen will decrease, and then our androgens or our testosterone will look higher as a relative to that dropping estrogen. It can also be a testosterone sensitivity. So the testosterone on a blood sample might actually look okay, but when you actually look into it, the metabolites of the testosterone are actually the problem. So identifying that as a driver is really key to understanding the hair and coming up with a great plan to combat that. The next hormone I look at is the thyroid. Now, thyroid is responsible for our metabolic health, and as it slows down, then it can also impede hair growth and lead to hair loss. So looking at a thyroid panel, again, can look relatively normal, but as a naturopath, I'm going to look at it from an optimal point of view and have a look and see if there's anything I can do there to make a difference to support the thyroid. Third and lastly, well, maybe not lastly, but the third one is ferritin. And that is looking at your iron stores or your iron storage. And if that's particularly low for any particular reason, often heavy menstrual periods or just not eating iron or not absorbing the iron, then it can be something that we need to look at. Also making sure then that we supplement with the right kind of iron is really, really important. So if you've got hair loss as a problem, maybe you want to have a little think about some of those tests, see if your naturopath, your nutritionist runs them. If not, maybe you want to come and see me. I'll put the link in the bio. And if you have someone else who's maybe got hair loss, you might want to share this with them.